The Honourable Jan Barham in reply.
Thank you, Mr Deputy President. In 2013, the late Adele Horan described the experience of placing her mother-in-law into a nursing home in 1996. She stated that her mother-in-law went from a placid, smiling and unsuspecting, physically healthy woman to a dazed, drugged and shuffling shadow of her former self within 2 weeks of entering care. Her mother-in-law was being given a major tranquiliser, Serenades, even though she'd never needed medication before and had never suffered a fall. Even though there had been so much reform of the aged care system since 1996, Adele asks, how far has aged care in Australia really come? Mrs Joanne McKeoch told the inquiry that, quote, the generation who contributed so much to the generations after them deserves safe and skilled care, end quote. But it seems we haven't come so far since 1996. The Living Longer, Living Better reforms have led to a greater commercialisation of the sector, and aged care providers are reportedly making record profits and spending less on skilled care. The care of our older, vulnerable people in nursing homes must be a priority for the New South Wales Government, and this inquiry into registered nurses in New South Wales nursing homes showed that we still have a lot of work to do to ensure our older people get the best quality care. Thank you to those members who spoke on this report, including committee members Courtney Hussis, Walt Secord, Bronnie Taylor, Natasha McLaren-Jones and Paul Green, and also Reverend Nile and Robert Brown and Robert Broadsack. Thank you for making your contributions. The views presented in this inquiry were often polarised, and I appreciate the efforts made by committee members to work constructively together. I also thank everyone who took the time to make submissions to this inquiry, particularly those members of our community who shared their personal stories about their experience of the aged care system. It was often these stories that underscored the need for registered nurse care in our nursing homes. As Imelda Gilmore said in relation to her 67-year-old husband who has dementia and lives in nursing home, quote, my heart's desire is to know that someone is caring for him the way I would if I could, end quote. Gerontologists, doctors, nurses, senior organisations, aged care operators and other experts in the field all agree that the kind of care Mrs Gilmore wants for her husband may only be achieved in a nursing home with a registered nurse on duty at all times. No longer are our nursing homes the domain of people who just need some help with showering, dressing. The inquiry heard that the average age of entry into a nursing home is now 84 years. The vast majority of nursing home residents have complex care needs that require registered nurse care at any time of the day or night. In New South Wales, 75% of nursing home beds are now occupied by people with high care needs. In 2004-05, that percentage was 64%. People are entering nursing homes later and frailer. On top of complex care needs, most residents have dementia, which often requires highly specialised care. Brendan Moore of Alzheimer's Australia told the committee that behavioural symptoms of dementia, which are known as expressions of unmet need, can include psychosis, aggression and hallucinations. These often occur at night. They are serious episodes and not something that can be managed by a personal care worker who has had only a few hours of dementia training. To be effectively managed, these episodes require the care and professional judgment of an experienced registered nurse. Registered nurses are trained to recognise symptoms that may indicate a serious condition and respond accordingly. Where there is no registered nurse, people are often transported to emergency departments. Professor Colleen Cartwright told the inquiry, quote, crisis events by their very nature are unpredictable. If there is no RN on duty, the enrolled nurse or assistant in nursing on duty may have no option but to send the person to hospital. We heard that ambulance transfers are often made at nights and on weekends, but there doesn't seem to be any collation of analysis by New South Wales Health of these transfers. Recommendation 1 calls on the New South Wales Government to collect and analyse data on the transfer of residents from aged care facilities to emergency departments and report this information in New South Wales Health annual reports. In other words, if there's no registered nurse available to help someone with complex needs, the New South Wales health system picks up the tab. I'm not arguing against the right of nursing home residents to access our hospital system. On the contrary, they're entitled to the care they need, wherever that may be. What I am saying is that registered nurses in nursing homes reduce unnecessary transfers to emergency departments, which is not only good for our hospital system, it's generally in the best interests of the older person.
100% correct.
I note that government members of the committee did not support recommendations 4 and 15, calling on the government to establish minimum staff to resident ratios and improve the wages of people working in aged care. These recommendations arose from evidence that some nursing homes may be dangerously understaffed but still manage to pass accreditation checks. One nurse or carer looking after 30 to 40 residents is not appropriate. We have ratios in childcare but not in aged care, despite the vulnerability and frailty of aged care recipients.
Burden. Didn't you know that?
I've heard the comments of Mr Brown about the use of the term burden, and I agree it is abhorrent. The inquiry also heard of the lower wages paid to nurses working in the aged care system compared with their counterparts in hospitals, public hospitals. This issue must be addressed, and this is why recommendation 15 calls on the Commonwealth to address this disparity. A personal care worker is paid less than someone who makes your coffee. What does this say about how we treat our elderly? Why is it that we don't pay someone who cares for our loved ones more than we pay someone who makes our cappuccinos? We need to recognise that if we are to value our elderly, we need to value the people looking after them. Care workers and nurses are more likely to feel valued and respected if they are adequately remunerated. The committee recommended that nursing homes looking after people with complex needs must have a registered nurse on duty at all times in the interests of resident safety. However, the committee recognised that in some limited circumstances this may not always be possible. There are some small rural and remote facilities that do not have the income to employ a registered nurse 24/7 or access to available registered nurses. Recommendation 8 allows for some facilities to be able to apply for an exemption to the regulation, acknowledging the unique difficulties these facilities face. Our inquiry recommended that government implement training and incentive programs to support registered nurses working in regional, rural and remote areas. Dr Marie Benoth said that there is no support for graduate registered nurses in rural and regional areas to stay. She said that rural facilities need registered nurses because there is often no doctor, and that registered nurse is integral to providing quality care in those facilities. The exemption is not intended to be used by facilities to avoid their responsibilities of care. A metropolitan nursing home with high needs residents should provide 24/7 registered nurse care. To assess this, an independent panel of gerontologists, doctors and other health professionals should be established to provide the expertise and professionalism to assess and determine exemptions on a case-by-case basis. Facilities should be required to show how they could provide quality care to residents. The facility would have to demonstrate that it can deliver the necessary care to its residents in a timely fashion. And also the exemptions, this is not in the report, but this is opinion that I hold, should only apply for 12 months. And hopefully by that time, any incentives and opportunities created by government might have corrected that situation of staff not being available. I recognise that many nursing homes are doing the right thing. They're providing excellent care to older people and already staff registered nurses. Our committee's recommendations, if adopted, would ensure that the standard of care was made available to all older people throughout New South Wales. Once again, I thank the committee members and the hundreds of members of the public who made submissions, and as always, many thanks to the staff who support our committees. The Secretariat staff are always absolutely amazing, and I particularly want to thank Teresa McMichael, Stuart Smith, Ria Victorino, Kate Mihalovic, Ivana Leo and Erica Vogels for their hard work, their professionalism and always the fantastic work undertaken by Hansard staff to record the proceedings of this inquiry. I commend the report to the House.
The question is,